The Morning Wave on Mix 93.8.
As you know, today is a very special day, not just for the station, but the show in itself, right? Because we are joined by a woman that, mums, we've been talking about for quite some time right now, and very, very interested in just knowing more about who she is. Often on this particular show, we talk very often about how we need to humanize situations, right? And we need to be able to connect with people, right? So it's not so much about the achievements and the accomplishments, etc. It's also about who you are as a person. Where do you come from? What are your values and spiritual principles that you practice? So I'm very, very pleased to welcome the MEC for the Department of Health here in Gauteng. And please, ma'am, I would love for you to introduce yourself to all of our listeners here at Mix.
Morning, Sam, and morning to colleagues and the listeners at home. Sam, I'm happy to be at Mix 93.8 because it's my first time to be with you. And I'm excited because now you are saying again, I must talk about myself, which I love so much.
Yes.
Because I'm just this normal rural girl that grew up in Eastern Cape, but ended up in Gauteng because of the studies.
Yeah.
And my father was working in Vereeniging, which is the area called now Sidibeng at Rand Water Board. And immediately when I passed my matric, I had to come this side to further my studies at the tertiary level, which I was focusing on the administration because I'm more of an administrator, Sam.
Yes.
For that, I become a politician.
Yes.
Hence, I'm doing masters even in business management as we speak because I love management.
Fantastic.
And I love to be a manager. I love to be an administrator.
Yeah.
But I love to be a politician because I'm involved in politics. And at an early age, I started to be in the legislature in 1999. So it's a lot of years, and I was there for more than 20 years in the legislature, which were making laws, which were doing oversight over government departments. I moved from those portfolios, starting being an ordinary member, to be a whip when you are there, to be a chairperson of various committees. But at the end, I chair almost all the committees. There's a portfolio called chairperson of all committees that they report to the chairperson. So I was leading at that. But again, I became the deputy speaker. Then after the deputy speaker position that I got, I didn't stay long. Then I was moved in 2019 to finance.
Yes.
And I led finance in the province, which those billions is about 150 billion that I was holding for all government departments. But now I've been taken to Department of Health and Wellness. But the interesting one, which young people like you like, is the ICT one. There was a department there, it's still there, called e-government.
Lovely.
It was the only department in the whole province and in the whole country because other premiers, they took that department to their offices. But this one, they created an own department but linked with finance. And I was doing a lot of training to young people on ICT.
Wonderful.
It was very close to my heart.
And
that's why I'm even translating it now to where I am, to health, because I want to digitalize now health where I am, which I've been moved last year. It's a year now that I've been there.
Yes. And MEC, I'm so happy that, you gave us a bit of background in the beginning, and took us through your journey up until this point. Now, I'd like for us to, before we take a break, to focus on your particular portfolio, right? So I want us to know, is there a reason for it being the Department of Health and Wellness as opposed to just health?
Premier decided that now he must add the element of wellness. He did that last year in October when he assigned this task to me because he felt that we have been forgetting that Department of Health must do wellness programs. But in the department, we had a unit that is responsible for that, but it was not performing to the level that he expected because there was nothing that everybody is focusing on. When we arrived, we started with the health strategy so that we uplift the critical areas, what we want to do, what is the expectation of us. So, and we're rolling it out to all the communities because remember again, he gave us a mandate, all of us as MECs, that we must focus on informal settlement, we must focus on townships, we must focus on the hostels. So now this element of health and wellness is interesting because I'm able now to reach out to communities, start doing some exercises. We launched a program called Wellness Wednesdays. Every Wednesday, I want everybody in his or her techies in the tights. If
That's
we have
the focus.
If you don't have in your shorts, you move around your building, you start doing some exercises. But we have a team and a pool in all the regions now that does those programs. Every health program I've instilled that you must start with some exercises or some aerobics or anything that will make you feel that you are really in the Department of Health. We have activated that, and I think it's going well because now people knows that there is the wellness programs that we are doing. We have reached out already to more than 100,000 human beings in the province. Yeah,
fantastic. Mums, you want to come in there for a second?
I do. I want to start from the beginning. MEC, what is a typical day for you, literally from the moment you wake up to when you go to bed at night? What is involved? What do you do?
I do a lot of things. I think quite a lot of things that I do, and I get bored if I'm not doing anything. When I wake up in the morning, I know that I must prepare myself to go to work, but always my work is exciting because of these programs that we've established and strengthened in the department. One of those which I enjoy so much is this one on wellness, which it encourages me. It makes me feel good because we have programs that we do hiking with the communities. We do 5-kilometer walks, whether it's 2-kilometer or 3-kilometer walk. But we even activated programs in the communities where elders are doing some of these activities.
Yeah.
I will invite you colleagues because there is a group in Bupilong in Tembisa that do some aerobics. It's elders that are more than 75, some of them 75 years. Some of them.
There is no excuse, mums.
Definitely.
There's absolutely no excuse. Please.
Well, and some of them have arthritis, but they do those exercises.
Absolutely.
They are young. You are not going to believe it, and I will appreciate if you can definitely do that.
Absolutely.
Another thing in the department which is exciting, under the Chief Director, Mutala Tala, we're now partnering with community radio stations, with radios like yourselves, because we want to have programs where our quality managers come and talk about the programs of the Department of Health at least once a week, so that if there are problems in a hospital, whether being Dipara, Charlotte Makleke, they come and you ask them what is it that they've come across during the week. It helps us because we're able to get communities, how do they feel about the service that we're giving them in the communities.
Absolutely.
And I'm sure you can see today that I'm wearing this.
Yes.
Well, we need to be posting. We need to be posting this on social media. Absolutely.
Campaign that we've just launched.
Yes.
So we have these exciting campaigns because this one, it talks about our attitude towards the patients and the people that we serve in our hospitals.
Correct.
So we always say serve them with a smile and care. But again, we're changing how we operate in the bank. There's a system that we're installing which is queue management, where I say operate like a bank. If you're a hospital, you must be like a bank.
Absolutely.
When you get into that hospital, you must ask me, how can I help you? With that smile and with that care. Because when you are being treated good by the security guard at the gate to the receptionist, you know that that environment is suitable for you.
Absolutely.
And that's the attitude that we want even from the hospitals, which I got it here, by the way. I was served with a smile and care. And that's why I'm excited to be with yourselves, because that attitude I will never forget.
I'm so happy.
If people are not treating you with that smile and care, you will never forget. Even if you can treat a patient good, that patient will never forget the attitude that you gave them.
Absolutely.
So hence you'll find some of them complaining about our health institutions, but recently we've been getting compliments more than complaints, and it makes us feel good. Those are the things that makes me want to go up and stand up and go up to work.
So it's
when I know that I've made a difference to the citizens, just to serve 2 or 3 people, it makes me feel so good. And I don't mind to do that 24/7 if I can be given an opportunity.
So this morning we're joined by MEC Nomantu Nkomo-Ralehoko. She's here in studio with us for an hour. And if you have any questions for the MEC for Health and Wellness, please send them through via that WhatsApp line 084-822-0938. We're going to talk about the various hats that you wear. There's going to be 1 or 2 very intense questions, but I know you'll be okay. You've also got a beautiful team here in studio. So, Mummy, I always say to my colleagues as well, as long as we follow this way, we have nothing to fear.
Of course.
All right? In the meantime, some Ugly Kid Joe, everything about you.
Everything.
5 after 10, happy Friday to you and yours. So this morning we're joined by the MEC for Health and Wellness here in Gauteng Province. Quite a number of messages coming through on the WhatsApp line, and as we said, we're going to take this conversation to where it needs to go to, right? To get to the heart of who we're talking to this morning. So MEC, there was a message that came through on the WhatsApp line. This individual and listener says, I have a friend who spent 2 weeks in the Edenvale Hospital. The nursing staff were miserable, didn't really seem to care. The food wasn't great. Eventually, her friend's son had to would come in to bring her food just to have a decent meal. And I think it would be interesting, MEC, for you to share with us how you would rate the health system in this province. So based on the criticism, perhaps previous protests in the province around water and resources, etc., how would you rate the health of the health system? So, of course, 10 being that the health system is near collapse, and, of course, 1 would be excellent.
You know, Sammy, I want to be honest with you. When I arrived in the department in October, last year on the 7th of October, part of the things that I had to take full responsibility is that our health system in the province is not right.
Yeah.
There are a lot of things that they are not doing right, being it in the financial side, clinical side, but I decided that I must visit all the hospitals in the province, including some of the community health centers that we have, which I always call them semi-hospitals because they do almost all the services that you find in a hospital. Part of those was exactly to address some of the issues that are being raised by Gail in Edenvale. I was there. In fact, I've been in Edenvale now. You go to Edenvale, it's completely different from what Gail's experience did because I addressed all those problems. I even called all the CEOs. We did an assessment. The meeting started at 9, ended at 2 a.m. the following day because it was a meeting where I wanted to know what is it that we can do to change the system because I am new in the system. I don't understand what's going on, but I know that there are a lot of problems. So my ratings will be at that time will be really poor.
Yes.
It will be, I can even give them 10 out of 100 at that time. But now I'm telling you, I can give them 99% because of the work that we've pulled through in the last 12 months that I've been in the office of changing the whole system, of making sure that where there are even CEOs that are not performing in some of the hospitals, I rotate them. I took Semi from here and throw Semi to Dr. George Mukari or Bukeng Hospital. So I've done that juggling around of them, and I've strengthened where there was no because I know administration. That assessment, I did it even with the team that is supposed to run the hospital. I've assessed them, I've assessed the institutions. Then after those changes that I've done, there's a lot of improvement in the hospital.
Absolutely.
That is why we even have now this campaign that I serve with a Smile and Care campaign. It was part of the problems that I was receiving, the complaints that I was receiving from the patients about the attitude that they get from our hospitals. But again, she is right when she says some of our employees, they were down morally, they were not right. They were not doing things. They needed to be motivated.
And I think
I
MEC
came up with motivational programs
absolutely
that boosted their morale because their morale was down. She's quite correct. She knows exactly what she's talking about. I can't deny it. But now there is a huge improvement because they were not even interacting amongst themselves and even share experience of what is it that they can do. Again, remember, they were even having financial problems of running the hospitals. We had money, but it was even difficult to pay service providers at that time because we didn't have money. Their money was just finished with all the lots of things that we have seen in terms of governance, corruption and other things that were wreckling our hospitals. But now we're clearing that, and it's difficult to do that, but I took a charge that because I'm responsible, I must take full
This is the work you have to do.
I must change these hospitals, and I've changed them for the better.
Yes, and MEC, I think that this is really the point of incorporating the wellness aspect. You know, if we look about the different types of wellness, we have mental wellness, physical wellness, spiritual wellness, emotional wellness. You know, if we can start having that conversation around wellness, it has a positive and direct impact on how we function in society. A lot of the conversations that we talk about here on the show is around trauma and how, you know, when people go through trauma, they end up creating trauma organizations that are riddled with people who are sitting with trauma. And how do we function in that society? How do we function knowing that we're carrying all of this with us? I think it would be nice to find out, MEC, you know, how you address your mental health. You know, what are some of the things you do to unwind, to de-stress and those kind of things? Just quickly for us before we take a break.
We've been addressing quite a lot of those programs again on mental health cases, but we're partnering with NGOs, by the way. Cancer problems, mental health problems, diabetes problems. Even on the 14th of November, I'm inviting you because we have a huge program.
Invite accepted. Invite.
Definitely.
You must join us because we will be going to the border of Northwest, and the MEC from Northwest will come and meet us in that border on your way in between Potchefstroom and Carltonville.
Yes.
We will be there doing some screening programs, but we are working with other partners, international partners that will be there with us, including Minister now is checking my program. He says he's going to be part of that program, because those are the things that we are doing, motivating even the staff. And I've said on the Wellness Wednesdays, that's why I'm forcing everyone to do those exercises. But again, we are saying when patients are waiting to be served or to be serviced, make sure that there are other activities that they are doing when they are sitting, so that they don't get frustrated and be bored. So we're doing that. We're introducing those programs in the hospital and in the clinics, and I think we're doing well for now, but still there will be those that are not satisfied, which I always say anybody that doesn't have a problem, they must follow us and address us on the quality assurance page, because we have a page that gives you the numbers of the treatment that you have received. What is it that we should do? How do you think we should improve our healthcare systems? Part of those is this initiative of coming to yourselves and say, let's have programs like this, because now Mix 93.8 knows that if you have a problem related to health, please communicate.
Yes. Well, that is what we're saying this morning. Absolutely. There is an opportunity here.
There's an opportunity for us now to have these interactions with yourselves, but directly again with the citizens, because they need to know what is it that we're doing as a Department of Health, because that's their right. And we need to improve the Department of Health, as you have saying earlier on, because we are going to have now NHI that is coming. That NHI, when it comes, that bill, it must find us already doing the right thing in our hospitals. People must know that when you go to a public hospital, you are equally the same like you're getting the treatment at the private hospital.
Absolutely.
And there's nothing that stops us from doing that, because doctors and nurses that are there are the doctors that work at the public hospitals. But now what makes them to change when they are at the private hospital? It's our attitude. So we have set our attitude that when you're at public, you must give people this underperformance, but we need the good performance. But again, it takes you to the attitude that we give those people.
Absolutely.
And the motivation that I must do as a leader in the department.
Service with
not
a
to
smile.
Throw my hands. Serve with a smile.
Absolutely.
And with care.
So we're going to take a little bit personal very shortly and find out more about the MEC and who she is. But in the meantime, Gypsy Woman, Crystal Waters, 12 after 10. 19 after 10, and I believe, Mums, that you want to come in there for the MEC?
I do. MEC, on a lighter note, I mean, we're heading into the festive season. And I can safely say I think many of us have had a very tough year. So how are you going to make sure that you take the time and you relax? Are you taking the time? And what are you going to do?
Is there time to relax?
I try in between to take time to relax a bit. I love my kids. I have 2 kids and I enjoy my family. So, but then again, I do read a book now. There is a new book that I'm reading, written by Maya Musk. A Woman Makes a Plan. And I think it's quite an interesting book.
Wonderful.
Ladies, you must just go and read it. And so those are the things. And I watch soccer. I love soccer. I'm an Orlando Pirates fan.
Yeah, I was about to ask who you're supporting.
Chelsea fan.
No.
So those clubs, when they're playing, I make sure that I watch them. Not Kosi.
Hey, I'm Kosi for life.
You supporting
Don't
Kaiser
see this
Chiefs?
yellow t-shirt and I cap
do.
and get confused.
Hey, man.
I'm a black and white girl.
I love it for you,
Let me
Yeah.
So I do have time. It's not enough as a mother and as an aunt, as a sister. My family always complain about my schedule. My mother was here and she felt that I don't have time to relax and to be with the family. But elders, they will always complain.
Always have something to say.
Always have something to say.
Yeah.
Because when I'm with her again, there will be always some fights, little petty fights, of the family. But
we still love them.
Yeah, I love
Absolutely.
them and I love my family.
Yeah, Mas?
Also, MEC, I just want to slightly touch on the topic of gender equity.
Yes.
I mean, the issue of women in the workplace, as overrated as it is, it's still very relevant. So from your own personal experience and from the women around you, what are the challenges that we keep on facing on a day-to-day basis that your male counterparts are not necessarily an issue for them?
It's very difficult to work amongst men as a woman because, again, when you are at the workplace, you have to make sure that you compete with men And even if people always undervalue your performance as a woman, so you always want to show off and show them that I'm capable, I'm a woman, but I can do things better than men. For example, I remember when I was put in the Department of Finance and e-government, people were complaining, saying that this woman, she's a woman, she's a black woman, she doesn't understand finance, she will not definitely perform. But and I've performed. I showed them that I can perform. I gave them clean audits in most of the departments.
Good.
And the big departments. So I was doing work that they underestimated, because it's always being run by a man, or if it's not a man, it's a woman, a white woman, not a black woman. So now it was the first time that I'm thrown there as a black woman, and I managed to sail there. So when you are being given that responsibility, you must sail. I'm the deputy chairperson of the province in Gauteng, but believe me, not everybody trusted me that I can lead, because I'm leading with the premier of the province, that you know him, the character, the caliber of the man that he is. So everybody thinks that no woman can match that standard, and we are there. But unfortunately, we're not being given a chance. Running this department again, people undermine me, especially men, because they thought that within a year, a month, I will collapse, because the Department of Health, it's huge. It's not a department that can be run by a woman who's myself, who's not not having that profession as a doctor or a nurse. And unfortunately, I've proved those people wrong, because I'm performing even better than those who have been there being doctors and nurses, because this thing, it's in you. But I always say to people, if you have management skills, you will perform any task that you are being given, because it's about organizing yourself, it's about making a plan, it's about planning. That's why I like Maya's book, because it tells you how to plan. When you do anything or any task that you are given, make that task a project. I always say that if you have studied project management at school, anything that you are being given, just do that cycle of a project management, you will never fail, because every day you give yourself to evaluate the work that you have done.
Absolutely. And MEC, one of the things that I also talk about is that, we need to often think about the message as opposed to the messenger. What is the good person, the good work that the individual is doing? And of course, I think it's important for us to take note that it's about the team, the people that are doing the work behind the scenes as well. So MEC, I want to...
Because I have the best clinicians, Sam, in the hospitals. I have the best team in the department that is surrounding me. I have the best acting HOD that is working with me. So and people will not see that if you always want to look for the negative things. But you prove that to people that this is the best that you have by your performance on the responsibility that you are being given.
MEC, in 2021, we know the incident that happened with the acting chief director in finance, right? She was gunned down outside her home, and she was, of course, a whistleblower and somebody who, of course, reported corruption in the Gauteng Department of Health. Now, since you've taken over this portfolio, and we keep in mind that it's only been within a year, all right? Can you perhaps share with the listeners as to what you've done to root out corruption at the Department of Health? What have you done to ensure that this particular department is run in accordance with good governance principles, to ensure that something like this does not happen going forward within your department?
Sam, I think before I even talk about this, I want to send out once again condolences to the family of Babita and her children. Because she was a woman, she was a mother, she still has a family that cares about her. But unfortunately, we had to lose her out in the department, under our department. When she was working, she was doing the right thing. And it's always when you are doing the right thing, you will be targeted, definitely. But what we have done now in her name is to make sure that we put up systems and the controls in the department so that we root out corruption. Those that are there, we take them out. So it's very difficult to work in that department. If you think that you can just come there tomorrow and clean everything, it's very difficult. We're trying, but I can't give up, because it's part of my responsibility to make sure that Babita's life don't just go in vain. She must know that wherever she is, that this woman understands the pain that she went through before she can even
for doing the right thing, by the way.
The right thing, by the way. So I am still fighting for that. I will make sure that in her name the department changes for the better. And I'm happy to say to you, we are changing for the better now, because all the elements that are wrong are out of the department. They leave, some of them, without me chasing them out, but because of tightening up of the controls, people leave. But you'll still find remnants that are there in the department.
So we're having a conversation with the MEC for Health and Wellness, and there's still a bit of time if you have any questions or comments to share at 084-822-0938. After this, we'll see what's happening in your headlines. So MEC, we've got a voice note here from Bianca Shaw, which I'd really love for us to play on the WhatsApp line.
Good morning, Sam and MSC. I just wanted to say to you, I landed up at Tembisa Hospital a year ago, virtually dead when I arrived at the hospital from a serious car accident. I spent 7 weeks in the hospital, and I must be honest with you, the care I received was, for me, absolutely perfect. They looked after me. They made sure the food wasn't great. I make no mistake about that. But the care I received and the compassion I received from the nurses at Ward 20, the sisters at Ward 20 was absolutely amazing. I just want to say thank you very much to all the staff at Tembisa Hospital.
Beautiful. And MEC, before you come in there and comment, I also want to take note of El Melly's message on the WhatsApp line. So El says, I'd like to thank Ina Grobler and Relaine Smith, who are kindly and efficiently assisting me at the moment. The loos at certain hospitals and clinics need attention, and you should remind patients to actually bring their own loo paper. But having said that, Randburg Clinic is the best run clinic I've ever been to. Good luck with rooting out the baddies. And imagine if we could brag about having world-class public health care. So we're talking about the fact that, yes, there are people who have had some incredible experiences during your term. That's the first one. The second thing is we need to also take note of the fact that, well, not everybody can afford medical aid, right? So how do we create an environment that is hygienic, that is efficient, that, has staff who smile at the door, as you said initially? How do we incorporate these wonderful campaigns? How do we incorporate wellness within this particular department? And I think it's very important for us to make a commitment to say, the people that Bianca specifically has thanked in this voice note, we need, as a department, to go there and thank them ourselves and say that, yes, there are people who are honest enough and who are willing enough to say, yes, despite what we hear on a daily basis, there is work being done, good work being done, and there is change happening within the department.
No, you are right, and I'm going to go there. In fact, even before you said it, I already indicated to my team that I must go there next week at Ward 20.
Yes.
And thank them on the wonderful work that they are doing. Encourage even others about what they are doing. And I want to thank everyone that has been sending these comments, because you will give us semi so that each comment will make a follow-up on those comments.
Absolutely.
Because we're changing this system and for the better. We want in fact, we are changing now the look and feel of the hospital. That's the other word that I'm bringing of. When you are at the reception of the hospital, you must see that this is the best place to be.
World-class service.
Yeah, world-class service. So we've started now with the renovations of look and feel. The grounds just at the reception area, and when you get to the accident and emergency area, you must find care. You must be assisted, but it must be the hospital. A better place to be than to feel that here I'm going to die. And I think we've done that. We are going to come up with we are doing awards this year, which they were done before, but now I'm resuscitating that. We are going to go to every hospital, check and see with this hospital now, before and now, and then after that we want to publicize that these are the 37 hospitals. Out of this is what we have received. We will go and do interviews even to some of the individuals that have been in the hospital, especially those that we know that they are not happy. They are still indicating that there's so much that needs to be improved so that we can change the feel of the hospitals.
And MEC, following up on what you've just said, mentioning something like the awards, is I think that in any organization, in any industry, when people feel that they are seen, that they are heard, that they're acknowledged, it motivates them that much more to do well and push the boundaries and do the good work. So if we're recognizing the good work that people are doing in public hospitals, I think, it will have, a much more positive effect on even what you're trying to do and accomplish within your portfolio. So MEC, just to kind of take it back to medical claims, there's a lot of things that go behind the scenes, and I would imagine that part of your role, as opposed to wearing many caps, is also to go into solution mode. So, I'd love for you to also talk about how health is being crippled by medical claims and what, or how rather, is the department handling this particular challenge?
It's quite a huge challenge, especially when I arrived there, we're sitting at 32 billion in terms of our medical claims, but now we've reduced them almost to 17 as we speak because of the processes that we've put in place. There are companies that are legal firms that are helping us in terms of mediating some of our claims, and now the numbers are going down, and we are really happy because that money will still use it to take care of our institutions once we cut those huge amounts that we have been paying as a department. But again, we're digitalizing our systems in the hospitals. In the we're installing now cameras even in the wards where we're doing the operations, because we know which wards and which areas. So we've identified which areas do we get these medical claims. Then we're making follow-ups on those, and who are the lawyers that are doing these claims, so that we're able even to investigate some of the processes if they are being done correctly.
Absolutely, and to make it a seamless process.
Seamless process. But now we're going for e-health in the department. Hence, it's easy for us to digitize now, so that those who are picking up what's wrong and how do we rectify the mistakes that we've been doing here.
All right, MEC, so we've got a bit of time with you left, and we're going to make full use of that additional time that we have. Any further questions and comments, you can send that through. We can take one or two more. In the meantime, Johnny Clegg, High Country, 36 after 10. So what we've done is we've brought the MEC for the Department of Health and Wellness onto the show this morning. It's been an opportunity for you to ask questions, to share comments, to make the MEC aware of the experiences that you've had, both positive and negative, all right? This is the opportunity that we've given you. And I think it's also important to think of the person, all right? Because MEC, we're not just dealing with a role here. It's not just about wearing this one hat, all right? It's about saying, yes, I am a mother. Yes, I am a woman. Yes, I'm having to deal with not just the department itself, but corruption as well. We've got so many different types of health issues, right? We're looking at substance abuse as well. We're looking at mental health. We're looking at medication. We're looking at the system itself. We're looking about hygiene. We're looking at resources as well. And lastly, systems. I think systems is a very important thing to often address. And MEC, in the year that it's been here since taking over this portfolio, I'd love for you to highlight some of those achievements in the last year or so.
Okay. What we have done, I'll start with this one on the digital fingerprints. We have digital fingerprints now that we've just launched, and it's working, and it's working even in the SADC countries. We even had a meeting with the ambassadors introducing it abroad. And when you are there, you are able to pick your finger and then press you, and then we'll know where you come from. And we are working in partnership with the Department of Home Affairs and Credit Bureau. Then again, we've made sure that they're fine. On the financial side, we have tightened up controls, working together with the Auditor General of South Africa, and we are working again with the PSC when it comes to e-disclosures of what we are doing. Again, those are the regulations that we are doing that are needed by Chapter 9 and Chapter 10 institutions.
Fantastic.
We're working very well, and we're taking health services to the communities, as I've indicated, your hostels, your townships, your informal settlement. We've launched Asbe Healthy GP campaign, which is a wellness program that we call it that way, and young people are following us. We've introduced Wellness Wednesdays under that GP Asbe Healthy campaign, and we have surgical marathon project that we are doing on monthly basis to eliminate surgical backlogs, because when I arrived, we had a huge number of surgical backlogs, people that are on the waiting list for more than 3 years to do their surgeries. Now we're reducing that drastically, and it's visible now, because the numbers were extremely high and now they are down.
They've been reduced.
So that's another achievement. We've improved again our infrastructure by adding more wards in our hospitals. All our hospitals now are having mental health care wards because of the importance of that area of mental health that is riddling our country and our children. So I'm happy with that. We are even renovating Bethakloa Hospital now, the old Bethakloa Hospital, to be a 100-bedded hospital now for mental health, specifically for that. And we're opening now clinics. About 6 clinics that already have opened. 3, we're left with 3. They're 100% complete. I will be opening them in the next coming month, which is another achievement that we're doing. So we have ambitious programs of building state-of-art clinics, forensic units that we are doing, because
pushing the boundaries, MEC.
Completely important area, the forensic pathology areas. And we have a training that we have launched in Garankuwa for FPS, I call them, forensic pathology officers. Services. So those guys are trained now. Even those that were not trained before, we're training them. We're reskilling the department officials, skilled and unskilling them. Those reskilling those officials that are there. Some were changing them where if you are no longer a person that is in the ICT, if you have an opportunity, we're giving you that opportunity.
Yes.
We're going to have a huge program on Nasispani that Premier speaks about every day. We will be having about 8,000 people that we have employed as a department. But we're partnering with TVET colleges. We're going to train them so that some of them can do painting in the hospital. Some of because
Absolutely,
the contract.
yeah.
Some will do the boiler, fix the boiler. So artisan skills want to do that. But
And
some it will be ICT skills
Absolutely.
on data capturing.
And MEC, you know, it's wonderful that in this conversation you have touched on the youth in its entirety as well, which I'm very pleased to hear about as well. You know, if you look at departments like Home Affairs, for example, you know, one of the things that people often talk about are the queues, you know, the long lines and people waiting to be assisted, etc. And I think perhaps even in the Department of Health, we need to look at how or what kind of plans you have to reduce queues and waiting times in hospitals. If you can please briefly just touch on that before we conclude our
We have
conversation.
started with that, with the queue management in the hospitals. We have that system that now it's working in most of our hospitals. But again, we have a system that when you are in Bara and you go to Sebokeng, already will pick you up that you did get medication at Bara yesterday.
Okay.
Yeah. So it's interlinked. So we're connecting now all the hospitals and all the clinics so that we're able to know what the right hand and the left hand is doing. So we're integrating our system and our services as the Department of Health. And we're quite doing well.
So we've spoken about a very extensive list of achievements in your term thus far since taking over this portfolio. I'm going to go to one last question from the listeners on this WhatsApp line. Yusuf on the WhatsApp line says, I have a question for the MEC. With corruption being so entrenched in a lot of government departments, what is being done at the Department of Health to give young entrepreneurs the opportunity to become vendors and service providers? And I think in your previous answer, you spoke about TVET colleges and taking the young people and getting them into these environments, correct?
Yes.
Yeah.
What we're doing now, we encourage them to be on the CST, which is Central Database System, where we meet young people. We'll tell them that there are opportunities in government, but you need to be trained on entrepreneurship. And the Department of Finance is doing that in partnership with all other departments. But there are services that we're giving them, that there are those that are benefiting from those services. But again, in the Department of Health, there are specialized services sometimes that you must do, and you must be SAPRA compliant. And then they were encouraging them even to register in those areas so that they get those opportunities, especially young people.
Absolutely. And what we're saying is that there are opportunities
There
indeed.
are opportunities for them.
Wonderful. The request that came through from Grant Bruce right here on the Morning Wave, I'm on fire, 5,000 volts. You know, we were promised an hour, and we did say that it's just going to be an hour with the MEC, but she has spent way more than an hour with us, and we are truly grateful.
Yes,
and thank you for choosing to be here today. You know, some of these questions we weren't prepared for, but you were willing to answer each and every single one of them. And, you know, I think it's important to find that balance, you know, to celebrate the wins, but to also address the challenges as well, which I think is very important, especially to add on to some of the achievements in the last year. MEC, just in, you know, a sentence or two, I'd love for you to share with the listeners what your vision is for the ministry and this particular department.
My vision is to see the Department of Health being well run, being the department that is accommodative to everybody, that accepts everybody.
Wow.
And that the staff is compassionate about the people that they are serving, and we want to serve them with a smile and care. That's my emphasis, that anything that we do, it must be something that everybody will be grateful to be in that hospital, and they will come back again when they are not well. But we want to reduce the number of people that are coming to hospitals because we want to prevent diseases and not make people to go to get sick.
Absolutely.
Hence our aggressive campaign to go to communities and talk to them and ensure that they prevent before they can be sick.
Yeah. And MEC, I love that you mentioned the word compassion, because even in our conversation this morning, it's about giving listeners and people out there the opportunity to show compassion for you. It is not an easy task, you know, and for that, you know, we do wish you well. And I always often talk about progress, not perfection. You know, even the small amount of progress is so invaluable as well. Absolutely. So to some of the comments and questions that came through on the WhatsApp line, MEC has said that we can share details as well. We're actually going to take some contacts from the WhatsApp line as well. And then what we're going to do is also share some of the contact details. Quality assurance, contact us for any hospital or clinic complaints. Please contact the Gauteng Department of Health on their 24-hour customer line. And that toll-free number is 0800 203 886. That's 0800-203-886. We'll also post this on the Facebook pages, the rest of the socials as well. Patients.health at gauteng.gov.za, or simply support at gauteng.gov.za. MEC, we have big plans, and I hear from Uncle Sean, Mr. B, as well, that he's got some wonderful ideas for us as well within the family business. So, MEC, I wish you all the best. Thank you for spending time with us this morning. We do appreciate it. We wish you all the best for the rest of your journey as well. There's a message here from Michael who says, please, we would also love our MEC to help with an anti-drug, alcohol, bullying campaign. Absolutely. And we're thinking about those young people as well. How can we give them the opportunity and the space to share and to deal with what they're going through in order to flourish within departments like this as well? It's been wonderful having you on the show, MEC. Mums, thank you very much for your great input as well. And we're sending everybody lots of love, light and prosperity. We will be in touch, and we are looking forward to a beautiful and fruitful journey with our MEC. Thank you so much, Ma.
Thanks for having me, Sam and Mami.
The Morning Wave on Mix 93.8.